Welcome back. During her annual visit to the Princess Margaret Hospital to begin the holiday season on Tuesday, Governor General Cynthia Pratt got an opportunity to visit the newly renovated Accident and Emergency Department. She had these words of encouragement for the staff at the Princess Margaret Hospital.
The work you do here is not merely a job. It is a vocation, a calling to serve. I commend each of you for your skillful expertise and the deep compassion you demonstrate daily toward the sick and injured. Your dedication transforms the lives of countless individuals and their families, reminding us of all the power of human kindness.
Prime Minister Davis was also there to cut the ribbon for the new Accident and Emergency Department. He had words of praise and also encouragement for the staff at PMH and the wider healthcare facility and system as well.
I believe we already have many of the elements to achieve success. For example, our doctors, nurses, technicians, pharmacists, and other healthcare professionals are well trained and perform admirably in challenging circumstances. In our hospitals, we see the very essence of our humanity, the determination to care for one another, to uplift those who are vulnerable, and to ensure that no one walks the most difficult moments of this journey alone. We acknowledge that it's far from perfect, and not yet where we would like it to be, but we are making meaningful progress on multiple fronts.
The Prime Minister said expansion of the Accident and Emergency Department at PMH will provide more capacity to serve the general public. During the opening ceremony and ribbon cutting for the new ambulance bay as well as the Accident and Emergency Department at PMH, Managing Director for the Public Hospitals Authority, Dr. Aubinet Roll, emphasized that repairs to the hospital's cafeteria is nearing completion.
In that process now, we have completed schematic designs. We're now going to move to architectural drawings. Once those are completed, then we will move to have the tender process for that to happen. So that's where we are. But I also want to note that there is no patient that is getting cold food.
Dr. Roll stressed the fact that despite the cafeteria being closed for a while, no patients have been neglected or served food that is inedible as suggested by certain individuals.
The process at UB is the same as any other restaurant any place else with the same quality of equipment. So when we talk about the patients' foods that are being transferred in a disposable container, that is to ensure the safety of patients. So when you're in a hospital, your food is just covered. But if we're transporting from one place to the other, it has to be contained. They're also moved in warmers as well. And I also want to stress, there is no ward in Princess Margaret Hospital that does not have a microwave to be able to heat up food for patients if that's necessary.
According to Dr. Roll, the necessary steps have been taken to ensure that patients are well fed with nutritious and tasty meals while the repairs to the cafeteria are ongoing. And finally, the Pan American Development Foundation and the United States Embassy conducted a Royal Bahamas Police Force Domestic Violence Certification course and recently held a graduation ceremony at the University of the Bahamas. The course curriculum was crafted for police officers in the Bahamas and comprised instructions on intake, assessment, treatment planning, and documentation for domestic violence facilitators, basic counseling skills, crisis intervention, case management, and trauma information care. 17 officers participated from the various divisions around the Family Islands. The information received is geared towards preparing officers to handle a domestic violence complaint from the station level to initial treatment and recovery processes. That'll do it for your JCN Evening News. Once again, I'm Dorino Saunders. Thank you so much for joining us.